nursing homes or whatever the case may be, where you can treat them at home and reduce a lot of the overhead costs. And I think as we get into this, again, the insurance companies and I think people will start to gravitate towards home health care more so than they are now, and I think there will be reimbursements to back that up and support that.
Thank you, Kim. We're going to take another question from Facebook. And this is from Buffy Baylog, who works for a dentist in Boardman. Will this plan weed out smaller medical and dental practices, or will it actually help them?
Well, it'll actually help them. I think that there's going to be another 30 or 40 million people who will be accessing the healthcare system, and in the essential benefits package will be dental. So dentists again, and I think there's some money in here to help train and educate dentists too. So dentists they'll be fine. They're gonna have a lot more customers.
Thank you. Buzz Bishner is the CEO of Forum Health. If Buzz would go to the microphone now, we'll call on him to have a question for Congressman Ryan. Thanks for joining us tonight.
Thank you. Congressman, obviously, thank you for this opportunity. It's nice to do this evening. And I guess I can say on behalf of people at Forum Health, healthcare workers, hospitals want to care for people. I think that's a given. So that's kind of the basis for my question. I'd also suggest that some would argue that everybody currently has healthcare today. They just use the emergency room versus the standard process. But my question is more into funding. I think you've been very articulate on the fact that as we have more people in the system using healthcare, there'll be more need for family care physicians, et cetera. That makes sense, and I think it is appropriate. How does that then play into the situation on how we fund the hospital world, which I live in now, as far as how are we going to make, how are we going to allow the hospitals to be more financially solvent and to meet the needs? Because obviously with additional need for health care, more service given in preventive and creative ways versus the more acute ways coming through the emergency room. How do you see that playing out?
Well, I think family docs, obviously, outside of the hospital realm are going to be a lot more prominent, a lot more busy. But what we would like to do with docs and try to do, model what's happening, and some of the local hospitals are already doing this, is to figure out how we can reduce the overutilization of hospitals and make sure that we don't take care of people and they leave and then they come back. And I think that starts with getting creative and incentivizing a relationship between the hospital and the doctor. And that's what's included in this bill, is to have these different care organizations that will do a couple of different things, but try to incentivize doctors and hospitals working together on the patient, like they do with the Mayo Clinic and some other areas around the country. And then also there's another idea of bundling payments where the docs and the hospitals work together, and we just pay the hospitals and you guys work everything out to make sure that everybody's working on the same page. But I don't think there's any, again, one silver bullet here. And I think as we have a universal system, we need to learn from local hospitals as to what's working, what's saving money, what's reducing costs.
Two things that come to mind as I hear that is, number one, you envision then more employed doctors by a hospital versus the more independent model?
I'm not sure. I mean, I would imagine as far as emergency rooms, there may be less, but as far as the preventative aspects, it depends on what the hospital does. Every hospital does, they all do different things, but it depends on how people make their way maybe to the hospital through the family care system that's in place. But I think everything's going to change. I mean, I think because of the transformational effect that I think will happen when insurance companies get involved in wellness, who knows how that plays out and what the hospital's roles will be. I'm not exactly sure.
Okay, so that's not really something that we really got to as we approach this bill, in your mind?
No.
Okay, so that's something that's in the future that needs to be worked out.
I think.
The one follow-up question I would have is, the other thing that has impacts on the viability of competition from hospitals and centers, surgery centers, et cetera, that basically handpick their cases and don't provide services that a not-for-profit must take and those kind of things. Is there anything going to be addressed in this bill or coming forward that you think will adjust that situation?
Yeah, I'm not exactly sure. There will be some physician-owned hospital reform. I don't know if there'll be an outright ban or if there'll be, you know, again, this is in the process here, to where I think a lot of hospitals will be grandfathered in who have already set themselves up. But on a go-forward basis, I think there will probably be a ban or a limitation to how much a certain physician can own of a physician-owned hospital, and you know, maybe that physician-owned hospital has to do some charity care, which I'm not sure how that's going to work out if we have everyone covered anyway. So I think all these things need to be worked out, but I think there's a general consensus that there will be something done, and there'll probably be some limitation, if not an outright ban on it.
Okay, because as you know, those facilities become the thing that's the safety net for a lot of our citizens when they're in time of peril.
Right.
Again, thank you very much for your time and the
Thank you.
opportunity.
Thank you, Buzz. Kelly Hall. Kelly, if you would go to the microphone. Kelly's a bookkeeper from Niles. Pharmacy and insurance companies are enjoying too much profit and healthcare is simply too expensive. Kelly, your question, please.
Hi, my question is a family of four earning about $42,000 a year. What would they expect to pay monthly for subsidized insurance if the public option is there?
Well, again, I mean, you wouldn't, if the public option was there, that's not the only thing that's going to get subsidized. All of these other private insurance plans will get, it will be based on you, your income. And then you'll get the subsidy, and you'll be able to go to the supermarket and pick which one you want. So people are saying that you're going to limit our freedom, you're going to limit our choice. That's not what's happening at all. You're going to be empowered to go to a marketplace that has greater competition. And so you will get the subsidy based on your income. I don't know exactly what it's going to be, but I would say the top out where it completely phases out is $88,000 a year for a family of four, I believe. And you would be half of that. So I would think you would receive a significant subsidy to help with your family.
On the flip side, what would I expect to pay?
Again, all those need to be worked out. You know, I would be wrong to say, but there will be a cap as to how much you'll pay a year. And so what we don't want to happen is your family to go bankrupt because somebody gets sick in your family, and we want to make sure that you have health care. I mean, here's the thing. This is going to help people who are working. This is, you know, again, just talking to people around town. We want to help people who are trying their best to make it. And I've had many people come up to me who say, maybe it's just easier for me to go on Medicaid. It's too hard, but I was taught to work, and there's dignity in work, and I want to work. I want my kids to see me working, not, you know, necessarily going on Medicaid or going on welfare. Those are the people that we need to help right now, people who are working and can't afford this. And you are someone who is like that. You will get help. And exactly how much, I don't know, but you would fall into the middle of the subsidy range. So you wouldn't get anything. You wouldn't go for nothing, and you wouldn't get everything. You'd be somewhere in between.
Okay, thank you.
I mean, that's the thing. And Buzz made a good point too, is that, you know, there is universal health care. And people who have insurance now, there's a reason it's going up as high as it's going up. We have these 30 million people go to the emergency room, and the hospital doesn't get paid. You know, no one gets paid for this. So it ends up when someone goes who has an insurance card, when they go, those 30 million people are reflected in your health care bill. So we're all paying for this now. What we're saying here is doesn't it make a lot more sense if we're already paying for this person that we have them pay some, first of all, let them come out of their own pocket a little bit, let them have some skin in the game. That makes sense. And then also help them get a prescription drug. Bob's told me this a million times. Help me give someone a $20 prescription as opposed to them coming to my emergency room a week later and costing me $100,000.